A significant portion of people who have DID or OSDD also qualify for a diagnosis of PTSD. This isn't really surprising because DID and OSDD usually involve a lot of trauma. What I want to talk about today is one potential way to help your system to reduce the chaos that comes from being triggered frequently and switching frequently. Now, I need to be clear that this is a potential path for some of you, but not all. Cognitive processing therapy, CPT, was developed to treat PTSD, and it's very effective treatment that takes around 12 sessions. When a system can identify a major trauma, or an early one that is representative of later traumas, this therapy can help reduce your PTSD, and that can reduce how much your system is triggered and how severe your other symptoms are. This can offer significant relief in a fairly brief period of time. Another potential benefit to this is if you have access to therapy, but you haven't found a therapist who seems to understand DID or OSDD. You can look for a therapist who offers CPT for treating PTSD and see if you can get some relief from this without ever officially working on the DID or OSDD. What I love about cognitive processing therapy, aside from the fact that it works so well, is that it does not ask you to tell the story of your trauma. All the therapist needs to know is a kind of title like, "My uncle raped me," or even, "My uncle hurt me." During the course of CPT, you will learn about how PTSD works, and you'll be given a series of worksheets that teach you skills that you'll be able to use for the rest of your life for everyday life issues and events. CPT says it teaches you to be your own therapist. These worksheets and skills will walk you through your trauma and what you believe about it and yourself. You'll begin to see where your beliefs are inaccurate. For instance, a woman who is raped might believe if she just hadn't worn that outfit, nothing would have happened to her. CPT would help this woman realize that what she wore had little to do with the assault, and therefore she is blaming herself unnecessarily. This is just one example. The point is that you will still have to confront the memory of the trauma, and this is not easy. But you will do it through the worksheets little by little, and in the comfort and privacy of your own home. The therapist will learn some details as you work through the worksheets, but you'll never have to tell the whole painful story to them, unless you choose to do the storytelling version of CPT, which is optional. I have found that clients who had DID or OSDD and who I treated with the CPT benefited a great deal. They still had DID or OSDD, but they had a lot less triggering. They were able to function better overall. I want to emphasize that this treatment will not be appropriate for every system. You will need to have an everyday life part who can consistently show up to therapy, be present to learn the information, and who can do the daily homework. Or you need to have a system where there's enough communication among enough parts who can listen in and work together and share the information from sessions and complete the daily homework. If your system switches uncontrollably, especially if it Rolodexes or switches rapidly, CPT is not a treatment I would recommend for you. But what if the cost of therapy is a barrier? If you have no insurance, go to the Open Path Psychotherapy Collective, where you can obtain access to reduced fee therapy from $30 to $60 a session. If this is not possible, then you may want to look at the workbook, Getting Unstuck from PTSD. This workbook was written by one of the developers of CPT, and it is excellent. I want to urge you to be cautious if you try to do this on your own. As I said moments ago, if your system switches rapidly and uncontrollably, then I would discourage you from trying this workbook. For systems with more stability, go slowly and carefully so you can see if your symptoms get worse after starting the workbook. If your symptoms get worse, stop working on the workbook and seek a therapist who will work with you, maybe pro bono, for even a few sessions. My preference is for any system interested in CPT to work with a therapist who can work with you to respond to symptoms that worsen if they were to do so. But I also want people to be able to help themselves recover. It's the whole reason I started this channel and am working on my community. I know it can be hard to get affordable or knowledgeable therapy for DID and OSDD, so I'm trying to fill in some of that gap with CommuniDID. And this workbook is another way to fill in that gap. Just to be clear, I do not benefit financially or in any other way for telling you about this workbook or for telling you about OpenPath. In the pinned comment, I've got the links for information about CPT and for the OpenPath Reduced Fee Therapist Directory.